He is the editorial director of American Institute for Economic Research, where he writes several columns per week and serves as an editor of AIER's book series. He is also a columnist for Forbes, founder of Atlanta Bitcoin Embassy, and a senior distinguished fellow of the Austrian Economic Center in Vienna. And there are also several other organizations as well. He used to serve as the editorial director of Foundation for Economic Education. He writes thousands of articles on economics, technology, social philosophy, culture. So without further ado, I give floor to Mr. Tucker.
Okay, very good. Thank you. Thank you so much for having me. This is actually a real pleasure to talk to you today. And I'm going to talk to you about coronavirus, COVID-19, and its relationship to individual liberty. This is a subject that has consumed me since my first article on January the 27th, and I'm sure it's consuming you too. As libertarians, we've been challenged as never before. For one thing, we've had a greater obligation than we ever have to speak forthrightly and openly and with moral courage on this topic at a time when populations are panicked, the media is howling the worst possible headlines they can. Politicians are using the occasion to redistribute wealth and enact big spending programs and force quarantines on everybody. It's been, for all of us, a tremendous shock, and it's not the case that anybody really expected this. When I wrote my first article on January 27th, it seemed like a speculative piece. I wrote an article about the government quarantine power and how this could be the greatest threat to liberty you will ever experience. And people wrote me back and said, I don't know. I don't think the government would ever quarantine people. I don't think that kind of thing ever really happens in the modern age. And why are you writing about this stuff? My thesis was that every time the government invokes a quarantine power, it leads to abuses. And I cited lots of historical cases. It's never been the case that quarantine power has been used judiciously or rationally or otherwise. And my concern was that if it was invoked in the case of the coronavirus, that we would lose a lot of our rights and liberties, and that we shouldn't. In that same article, I also explained how a system of liberty deals better with pandemic disease than any central plan ever could, by being adaptive and incorporating new information and inspiring changes in people's behavior, and that we can rely on fundamental libertarian principles to get us through this crisis, rather than just unleashing state power, as it turns out we did. I can't speak to the case in Europe or Turkey because obviously I'm not there, but I will tell you about what happened in the United States. Basically, the worst nightmare that ever could happen happened. And let me further say this before I go any further. I think when I say this has been a challenge for libertarians, I don't mean just that we've been called upon to justify our belief set, or that we have to take this. When I say libertarians are being challenged, I just don't mean that we're expected to respond and that we have moral obligation to stand up for the right position. But I think intellectually it's been difficult for the current generation of libertarians to process this. Like, they hadn't really considered whether or not we can have liberty in times of crisis on this level. So this has been the biggest problem, I think, for us intellectually, to think through how liberty will solve this issue better than the state. I will tell you, the way things fell out in the United States was as follows. You know, the virus began in China, and we had a test run of from a medical point of view, how this thing might play out. The Center for Disease Control in the United States never took it seriously. They paid no attention to it whatsoever. China shipped to the US many, many tests, but we didn't do anything with them. The World Health Organization shipped to us hundreds of thousands of tests that could have been duplicated. The Center for Disease Control did not distribute them. Instead, they spent all of January, February, and a good part of March stopping private laboratories from testing and distributing COVID tests so that we could understand what we're dealing with. They fined and banned and delayed, and they behaved like a bureaucracy. This is a bureaucracy with something like 11,000 employees and a budget exceeding $1 billion a year. And I have a friend that did a calculation that the average employee they're spending $1 billion per employee at this government bureaucracy, and they use all their powers to do what bureaucracies do, which is not to help people, but to stop the tests from being distributed, innovated, and sent around the country. So as a result, people began to panic. I compare this to what happened 10 years ago with H1N1, the bird flu. I think it was the avian flu. What was 10 years ago? It was the bird flu, right? Avian, I think, H1N1. And every drugstore you would drive to in the United States would have a test, and they were begging you to take the test, and nobody took it very seriously. It turned out at the end of that, 60 million people were infected and 14,000 people died from that flu, but it really never really made the headlines, and nobody paid that much attention to it whatsoever. As I think about why this time it's different, there are a number of factors that play into this. There's a sequence of events that occurred. There was a nursing home in Seattle where, because in the United States, everybody figured, oh, well, this will be like every other seasonal flu that ever happened. We don't have to do anything. We don't have to pay any attention. We don't need to test. We don't need to start worrying about vaccines and all these kind of things. Let's just forget about it. But then the peculiar aspects of the disease began to reveal themselves. This is a virus that targets elderly populations with pre-existing conditions, basically old people, unemployed, living in nursing homes who are sick. And one day in Seattle, at a Seattle nursing home, the staff arrived to find, 15 or 20 of their patients were on the verge of death, and then they were dead a couple of days later. This made the national headlines, and it threw everybody into a panic, and they wanted to know, what is this thing? How bad is it going to be? Do I have it? Do you have it? How do we get rid of it? How does it transfer? What is the contagion effect? They wanted to know, but they couldn't know because the CDC had blocked all testing. And if you know something about your Hayek, he talks about like information dispersion in society is the essence of how society works. Like, we have to have this signaling system so we know how to behave. If we don't have them, we replace rationality with power and chaos. It goes no information, there's chaos, and then we reach out to power. And that's exactly what happened over the course of the coming 2 months. The response was very much driven by this sense of public panic, not medical rationality, not therapy, not disease mitigation, as we've always done, but rather we started worrying about containment. Basically, the attitude in the United States was, get rid of the virus, make it go away, send it back to Wuhan, China. We can't stand this anymore. This is very bad. And the only thing that people really knew how to do was to lock down the economy so that it wouldn't spread anymore, so there would be no more contagion. That it was an outrageous, medieval, and essentially irrational response to a medical problem. We used a political solution, which is basically the worst thing you could ever do. And so we began, and then the very next thing that happened was that the predictive modeling started coming out of the Imperial College in London, especially, and then the CDC. And the numbers were outrageous. They were saying things like there would be 2.2 million dead. Maybe it would be 1 million dead. But in any case, the death figures were going to be in the millions. But there was always a qualifier to these models that were coming up. If we did nothing. Okay, what does doing something mean? Well, in this case, they said, well, we can flatten the curve. Now, I'm sure you've heard this, probably in European politics, this is also all the rage, to flatten the curve. The idea is that if too people get too sick too quickly, then our healthcare resources will be overwhelmed. And so we need to stop the contagion or slow it down. So the idea of flattening the curve is not to cure disease. It's not to mitigate disease. It's not even to reduce the number of infections. It's to slow down the amount of pain that society will experience in order to preserve healthcare resources. Very interesting, actually, if you think about it. This is what led to the lockdowns, this belief in flattening the curve. And you flatten the curve through social distancing. Now, these are very interesting phrases. Flatten the curve through social distancing. Flattening the curve amounted to treating people as if they have no volition, no rationality whatsoever, and like gaming the system in a centrally planned way to spread the pain out for a very long time because healthcare resources are limited. Now, why are healthcare resources limited, and why didn't people believe that the healthcare system could in fact scale up? It's because, despite what you might have heard, in the United States, the U.S. healthcare system is heavily, heavily regulated. It's not really capitalistic. It's not really a market system. It's one that's managed by government power. So just to open up a new hospital, you have to have a certificate of need. And people can work on doing this 10 years and still fail. So there's a massive rationing of hospital beds in this country, and the number of people qualified to practice medicine. Medical schools in the US have been restricting entries for more than 100 years. We don't have a market-based system of healthcare. That's why it couldn't scale. Markets specialize in scaling. As we've seen at the grocery stores recently, people one day decide they all want chicken, so they buy all the chicken. Well, the next day, the managers order 3 times the amount of chicken. So, to meet the supply and demand are working in markets. But in the healthcare realm, supply and demand did not work. We had new demand for services, but they couldn't expand supply because of all the government regulations. So that was a failure in itself. That's why we needed to flatten the curve. No other reason is because we didn't have scalable health systems because they're not market-based. So here you see a price being paid. So we're already seeing like 2 gargantuan government failures. One, the inability to create and distribute tests because it was ruled by a bureaucracy. And 2, we had to flatten the curve instead of scaling up and having supply to meet demand, because all our healthcare systems are basically socialist style healthcare systems. And I understand this is certainly true in Europe. It's probably more true in Europe than it is in the United States. And then you had the slogan of social distancing, which is basically amounts to just stay away from everybody. Just have nothing to do with anyone. They probably have a disease. You don't know if they do, they may not, just stay away. And then that's when the panic really began, because that's when people had to stay away from each other. You started thinking everybody was infected. Even if they weren't infected, you can't even gather in groups because, my God, if you get 3 to 5 people together, probably even if they're not carrying COVID, they will generate COVID, just because they happen to be standing around each other. So, and that's when the public panic really kicked in. And the politicians then began to evaluate their reelection chances and realized that they would be blamed for every death that would happen under their watch. And so they just screamed to everybody, stop whatever you're doing. Stop whatever you're doing. In the US now, we have probably upwards of 20 million people who have filed for unemployment. People can't pay their rent, so there's politicians urging that we forgive all rents and nobody has to pay rent. Well, that's a serious problem for people who, for whom rental properties are their living. So now they don't have any income and they can't pay their mortgages. So the whole economy is connected. You can't just set out and say, this is an essential business. You can keep operating. That is an unessential business. You can't operate by force of law, because essential and unessential, these so-called terms, are connected. Everything's woven together. So the essential will definitely at some point start to break down unless we do something about this. I mean, already our food delivery services in the US have panicked employees, or they're unwilling to show up to work, so deliveries are late. Meat packing plants are reporting shortages of employees. So essential delivery will start to go down because the entire economy is basically crashing. And that's what's happened to the US. I think probably we're going to see in the second quarter 30%, as much as 30% declines in GDP, which is just unimaginable. We don't even have words for this. Forget recession, forget depression. We're talking about an unbelievable unraveling of civilization. And there's all sorts of perverse effects to this. In the US case, hospitals were suddenly taken over by governors and with new edicts. And the edict was the only kinds of surgeries that can happen here are those that are non-elective. So only life-threatening surgeries, mostly related to COVID. And that happened all over the country. Now, keep in mind, in the US, we only have 1 or 2 or 3 hotspots where there's actually a problem, to say nothing of the shortages in hospital beds. Right now, by the way, New York has a vast surplus of hospital beds. I don't even know what to do with all of them. But throughout the rest of the country that were facing these edicts from government, suddenly the hospitals, because they didn't have any actual COVID patients, were not allowed to do things like surgery for cancer, for transplants, for anything that was so-called elective, which, by the way, elective, that doesn't mean a nose job or some vanity surgery. It means something that is scheduled out in advance, from which you're not going to immediately die if it doesn't happen. I mean, that's what it means. But you're still going to die, but just over a longer period of time. Well, in the United States, vast numbers of hospitals throughout the entire country are now empty. They're like ghost towns. So they're not making money. So they're furloughing workers. So we're in a crazy situation where workers are being let off. Nurses and doctors and hospital administrators are being furloughed, kicked out of their jobs because they don't have any work to do because of these central plans. Well, I could go on with the very perverse consequences. I think at this point, my friends, unless we open up now, as in today, as in everything, we're going to see far greater deaths taking place throughout the world, and I know in particular about the US case, from things like suicide, delayed surgeries, drug overdoses, probably gun violence. All of this is coming. And in the final toll, I think that this is much greater a threat to life itself than COVID itself. Some epidemiologists in the US believe that the only way that you can really deal with a virus is through so-called herd immunity. So that you need the populations that for whom it's not lethal, for whom it's either no symptoms or the sniffles or maybe a day in bed or two with some fever. You need them to get the virus in order to create the so-called herd immunity. I'm not an epidemiologist, I'm not a specialist, but I do know that that connects with everything I have ever learned about viruses. So instead of allowing the herd immunity to take place among the non-vulnerable populations and then isolating, as the market would, vulnerable elderly populations, instead we just shut down everything and delayed the herd immunity and made the virus more fierce, and then sent it into nursing homes so that far more older people are dying now than would have died. I listened to a lecture by an epidemiologist this morning who said that if we had never locked down society, that the virus would have been gone. by now, which is a terrifying thought. I personally can't vouch for that opinion, but I'm saying that these opinions are out there. When the decisions to make the lockdowns happened, there was essentially zero consultation with medical professionals or serious epidemiologists or anybody other than these bureaucrats with MD, medical doctor credentials that are working for governments. That's it. But they didn't talk to medical professionals. In the United States, in early, well, I guess it was late February, mid-February, late February, 800 medical professionals, epidemiologists, and otherwise associated with Yale University signed a letter begging mayors and governors and the president and senators and congressmen not to shut down the economy, because they said it would create a worse conditions than allowing society to continue to operate, so we could treat this as a disease. Political solutions are not the proper way to deal with pandemics, which is exactly what I wrote January 27th. This is going to create greater problems than the disease itself. A few other issues here. Probably you have in Turkey and throughout Europe what's in the United States called price gouging laws. So you can't raise the prices of goods up for supply and demand purposes. So just as with hospitals, there was rationing that occurred in the US. So the thing that everybody wants most of all, I didn't know this, maybe you didn't know this, is toilet paper. So immediately that vanished from the shelves. There's no toilet paper to be had, and people began to panic about that. And they couldn't raise the price of toilet paper for fear of being prosecuted for price gouging. So that created the shortages in the grocery store. So at every stage, what you see in this unfolding of this incredible calamity is a failure of government at every stage. And then the spending programs came along, and now in the US we have outrageous promises for unemployment insurance to pay people to not work. So even if we open up today, it's probably people are going to make a lot more money, at least in the short term, from not working, living off government welfare, than working. All of this is happening. One final point, every governor and mayor in this country imposed social distancing rules. This is based on the theory that we should flatten the curve, and so on and so on. And now people are being dragged off subways and off buses and being denounced. And there was even a murder reported yesterday for some guy who was shot for getting too close to somebody else under social distancing. So my friends, this is madness. And it's a complete disaster for human liberty. Let me conclude my opening remarks here with the following point. I'm speaking, I think, to a libertarian audience, and we're all wondering what we should be doing about this. I'll tell you what you should be doing. You should be loudly and aggressively and courageously, in every venue you possibly can, call for an immediate opening of the global economy. And I mean, not just in Europe, in Turkey, or the United States, but globally. We need open trade. We need freedom back. We need our civil liberties back. And why? Because only under the conditions of liberty are we in a position to actually deal rationally and reasonably with the presence of a new virus. New viruses will come along again in the future, just as they have at every point in human history. We have ways of dealing with them. That's why we have medical professionals. The politicians are not the right way. We need to argue for an immediate opening, even if that comes with risks, because at least society can adapt, and we can evaluate those risks on our own, consider various alternative routes, and get back to our lives, making money, serving each other, and eliminate this despair, this terrifying loneliness, the tragedy of global governments around the world having put their whole populations under quarantine for the first time in human history. I will conclude with this remark. If you're not a libertarian, at the end of this, you have not been paying attention. This is our moment. I don't care about a movement, really. I just care about the flourishing of civilization. But I think that right now is a time where the whole world needs to re-examine their commitments to things like human rights, freedom of association, to the rule of law, to our right to live as we choose. We have to. When this idea of human liberty was first hatched at the Enlightenment, there was never a footnote that said, of course, none of this applies if there's a pandemic disease. No, there were plenty of pandemic diseases all throughout the High Middle Ages and all the way up through the founding of the modern era. Certainly the US Constitution was written at a time where the diseases were everywhere. And we've never considered getting rid of rights and liberties because of the presence of disease. No, we deal with disease as rational people, with medical professionals, with science and with rationality, but we never give up our liberties, never give up our liberties. So that's your job. As libertarians, we have to change the terms of the debate. It's up to us, starting today, to change this debate. I don't mean we need to have a conversation about opening up. I don't mean that we need to have a long-term plan to open up. I mean, we need opening up now before we give up everything that we call civilization. So I will conclude my remarks there, and glad to take any questions. And thank you for listening to me.
Thank you very much, sir, for these insightful points. Indeed, a very harsh battle is waiting us aftermath of this virus. Now I will ask questions from the audience. First one is, do you see this as an opportunity for healthcare to come into the sharing economy, like Uber, to increase the supply of healthcare? Yeah. I recall seeing an article on Fee about this.
Yeah, no, there's no question. There's going to be a lot of reforms going forward. Like in the US, we had just started getting going on medicine that you could just call a doctor on the internet. It's actually interesting. I had this experience. When was it, Alex? Like 4 months ago or something? I needed something. I don't remember what it was. Oh, it was a prescription for something. Anyway, I got on telemedicine and the doctor gave me a prescription. But these guys up to now have been operating a little bit sketchy, and the regulators were going after them. I don't think that's going to be true anymore. I think that medicine's going to go entirely digital, and it's going to be much more market-based after this. And this is where I'm actually slightly optimistic. I mean, these government rules have been so bad, and they've prevented a reasonable response that, yeah, we're going to have to open up. And I think everybody knows this. The regulations on testing, on treatments and drugs, distribution of vaccines, everything will have to open up. And to tell you the truth, I think at the end, and by the end I mean I can't give a time frame, but once the dust settles on this calamity, I think there's going to be a real opportunity to take back our freedoms. We can't go back to the regulated system because it was precisely the regulated system that caused this disaster to take place. So yeah, things will open up, and who knows? Maybe at some point you'll have the doctors being able to come back to your house and make house calls. That hasn't happened in about 50 years in this country.
Thank you very much. One of our colleagues from Turkey is asking, why isn't there any government which finds herd immunity strategy reasonable, and why people are against it, even governments, when even governments like UK tried it?
Well, and this isn't even a theory, you know, herd immunity is the only way modern science deals with these things. We know how viruses work. So this is not a controversy. What happened in the UK is that Boris Johnson was trying this herd immunity thing, but then the Imperial College of London with Neil Ferguson, and these guys are like virologists, they're not actually epidemiologists, and they're not mathematicians, they're not specialists in computer models. They came out with that study, and that was March 12th, that said that millions upon millions would die unless we locked everything down. That's what the study said. Now, it's since turned out that the study released by Neil Ferguson and the Imperial College of London had terrible assumptions baked throughout it. They had no idea how many people already had it, what the effects would be, what the particular demographics of this would be. They didn't know anything, which is typical with computer models. You know, you garbage in and garbage out. You plug in, you pull down your stat program, you put in all your assumptions, press the enter button and look at the pretty pictures, and that's the way they worked. And it terrified the political elites. And that study was distributed in the US too. And several other people were replicating these studies. Now, at the same time, there were other professionals that were saying this is all just complete nonsense. That study that Ferguson did was the same study he had done for avian flu, for the mad cow disease, for the lamb disease, for every flu for the last 30 years. He's been recycling the same model, and it was just slapdash and terrible, but it terrified everybody. And then the press got a hold of it and went absolutely insane and panicked politicians who were afraid and risk averse. So that, I think, that's the story of what happened. And then that was also combined with a shocking amount of clusters of death in certain hotspots. That's really unlike regular flu. Flu, which are probably in the end, once we look at all the data, seasonal flu is going to be as deadly, if not more so, than COVID. But the difference is that COVID appears in local places and kills lots of people and a certain demographic very, very quickly. And that's optically very shocking. So there was a kind of panic. Now, that panic did not happen all over the world, to be sure. It didn't happen in Sweden, where everything was very rational and the press did not hype things up. The politicians didn't panic. It didn't happen in Japan, where there's been, the politicians have been involved at all. It was a matter of isolating and separating the sick and letting society go on as normal. So if you go to Tokyo today, it looks like Tokyo a year ago. There's really no difference. And it's very similar in Sweden. They didn't close bars and restaurants. They didn't. My friends in South Korea, all right, so they had universal randomized testing. So you could just drive up to the drugstore and get an immediate COVID test, positive, negative. That had a calming effect on the population. They didn't close down anything. I'm telling you, during the entire time of this fiasco in Europe and the United States and the UK, all my South Korean friends have been posting Instagram pictures of themselves at bars, at restaurants, at sporting events, hanging around doing normal things. So that has actually been going on in South Korea. So we do have cases. So the South Korea case, the Japan case, and what we've seen so far is that the governments that were much lighter without lockdowns have seen the contagion controlled, levels of death arrested and minimized. And this is a real empirical experiment. I'm really grateful for South Korea, Sweden, and Japan and others for this, because they're showing us that Europe, most of Europe, took the wrong direction. And the US, actually, ironically, I mean, think about it. The US copied China in its tactics for dealing with disease. I think Boris Johnson was on the right track, but he turned the other direction once that Imperial College study came out, which is very different from the studies coming out of Oxford, actually. There's a big competition between the two. The government got scared by the Imperial College study and ignored the Oxford study. It was a terrible, terrible tragedy.
Thank you very much. Do you think, can we attribute this difference of strategy on the availability of testing kits, maybe? Because in South Korea, as far as you know, they can test extensively, but most countries, including Turkey, United States, European countries, they can't afford to test as fast as they do.
Yeah.
Do you still think
Yes.
It's not justified to lock down?
I think there's no justification for the lockdowns whatsoever. We didn't have testing, and that's what drove the public panic. But even in absence of testing, there is no justification for lockdowns. That just makes everything worse rather than better. And it's not that the US couldn't afford tests, it's that the Centers for Disease Control, which is a federal bureaucracy, refused to distribute the tests from the World Health Organization and refused to permit private distribution of their own tests. So we created a shortage of tests, and that's what led to the public panic and the worry, because I didn't know if I had it. I don't know if you had it. By the way, there's ever more information coming out that we're pretty sure that this virus circulated widely in the US from late December. And all throughout January and February, people were getting infected by it. Most of it is asymptomatic. Some people, it's a little bit of a cold. Almost everybody I personally know, and I live in the Northeast region of the United States, not far from New York, in the middle of March, were privately admitting to me that they had COVID symptoms sometime in the previous couple of weeks. And I will count myself among them. I did too. So for some people, it was kind of bad. Other people, it wasn't that big a deal. It wasn't that big a deal in my case. I went through 2 days of a little bit of an awareness of a breathing issue. And I became aware of my heartbeat. You know what I mean? Like you don't normally notice your heart beating. I was like suddenly aware that my heart was beating. It's very strange. So I can't get a test. I can't even get a test now, but I feel sure that I had it briefly and I'm immune. And same with all my friends. Almost everybody, I can't think of any exceptions, have admitted that they're pretty sure they had COVID. And even if they didn't have symptoms, they probably had COVID. So there are millions, tens of millions of people very likely already had it. And that's how we're achieving the herd immunity, which I think has probably already been achieved in this country. That's very difficult to know. You can't, like even the best epidemiologists will not know for sure that we've already achieved this. But it's possible that we're going to get a second wave. It's also possible that if we open up right now, we're going to see more infections and more deaths. I mean, it's just true. But there's no avoiding that. You cannot destroy society itself for fear of a virus. That's just utterly crazy. That's not the way any civilized country would go. So I disagree with the lockdowns in the first place. And yes, I believe they should be ended immediately. And let me just finally conclude with this, that if we had had a market-based system, there would be tests everywhere. I could go out and get a test. Anybody could have gone out and gotten a test if we had a market-based system instead of a government bureaucracy running this. And that would have vastly helped things, just as they did in South Korea.
Thank you very much, sir. We have a question from Bill Wirtz from Luxembourg. You recently had a post on Facebook addressing libertarian concerns on the issue of the non-aggression principle. Some libertarians use non-aggression principle to justify their support for the lockdowns. Would you mind explaining your position?
Yeah, thank you for asking that. That's interesting. I posted that, and lots of people got really interested in it. So I don't mind the phrase non-aggression principle, but the problem is I don't think it has a lot of content. Like, people don't really know what aggression is. That's not intuitively obvious to people. So I've never really been happy with the idea of reducing libertarianism to this idea of the non-aggression principle. But it has happened. Sometime in the 1990s, this began to happen. In the early 2000s, people said, what's libertarianism? Oh, it's the non-aggression principle. So if you don't have a good sense of history or an understanding of the way liberty works or society works or whatever, you might just like randomly apply the non-aggression principle to the case of disease. So in that case, it's like aggression to pass on a disease. And then you're like, well, then clearly the government is doing a good job and locking everybody down, violating your liberties because you're preventing aggression. So you can see the way this works, right? This is a certain mentality. My argument against that is that disease tracing is actually, infection tracing is almost actually impossible. You can't know for sure who's giving you anything. I mean, we tend to do this, these days. It's like you come down with a cold and then you're mad. You're like, who gave this to me? Oh, probably my girlfriend gave it to me. What a witch, It's like a vicious cycle because you can't actually prove anything. There's really no way that you can scientifically do this kind of infection tracing. They couldn't even the best experts in the world couldn't do it, even with AIDS, which they knew how that was spread. And even that was impossible. The other problem with that is that once you start thinking this way, then you divide society. Like everybody becomes the enemy of everybody else. Why did you aggress upon me? It's just simply not the case that in a default state of nature, we're all in perfect health, and that if you ever get a disease, that's because somebody aggressed on you. That's just not true. Diseases are part of the natural world. They come, you get them, you get immune to them, and you just deal with it. That's just what mature, reasonable civilizations do. And if you start applying the NAP to this, I think you're creating a prescription for something like a massive calamity. I think also in that post, I passed on an anecdote that I had from my own childhood, where I had an enemy. I think it was maybe 4th grade or something like that. I had an enemy in my school, and I came home and accused. I had a cold, and I accused my enemy of passing it on to me. And my father corrected me immediately. He said, "We do not think that way. That is ill-mannered and evil. And you're spreading rumors about others, and spreading rumors is worse than spreading disease." So he stopped me from that, and that was the ethos in those days. You know, and I'm not sure I've covered every point about this NAP. Maybe I should take it more seriously. It's very difficult for me to take some of these didactic issues too seriously. But when I was a kid, there was this disease called chickenpox. I'm not sure what it's called in Luxembourg or Turkey, but it's a virus, and it comes along and makes you spotted. You want to get it when you're young because then you develop immunities to it. So when I was in something like second grade, a kid in the classroom got chickenpox, and so he had a chickenpox party. And every parent knew this, that the idea was to make sure that you get this disease as soon as possible, so that way you didn't get it as an adult. Now, nowadays we have a chickenpox virus, but back then we controlled it through herd immunity. So, so the first kid that got chickenpox had a party, and everybody in the school that could fit into the house went in, and the parents encouraged all the kids to play hard and touch each other and spit on each other and everything else, so that everybody would get it, and it would last 2 or 3 days, and then the rest of their lives would be good. So, and we had a very different attitude towards viruses then than we have now. Now we expect to take a pill or take a shot and it'll just go away, and I'm not sure that's always the best way to go about it. But anyway, thank you for that question. Maybe I should actually write up my comments about the fallacy of believing that the NAP pertains in this case. I think it's absolutely perverse the way libertarians can twist, some have and do twist the main message of our philosophy, that people should be free to associate, to speak, to publish, to travel, to trade, into a justification for the most totalitarian, draconian actions of my entire life. And I think that's just weird. Like, something should go wrong in your mind if you're justifying these lockdowns going on right now. Under libertarian guise, something's gone wrong with your attitude. And the whole history of liberty, libertarians have always been against quarantines, forced quarantines, always been against top-down planning and violations of essential human rights. So you can't use libertarianism to justify this. But thank you for that question.
One of the questions that my colleagues from Students for Liberty Turkey wants to ask you is about the public perception of lockdowns, because I don't know much about Europe, but at least in Turkey, maybe for the first time in our political history, the opposition was criticizing the government for not declaring a lockdown as early as possible. And this is weird for us, because in our political history, lockdowns are like the symbol of oppression, especially during the military coups. So what do you think about it? I mean, when the public wants lockdowns so bad, and you're trying to manage a disease, pandemic, how could politicians respond to this?
Okay, I'm not sure the public really wants lockdowns. I think what happens is, certainly under a lockdown case where everybody's afraid to speak and they don't know what to do, there's a lot of confusion, that sort of thing. The problem is that in this case, this disease has been used for political purposes. So I'm sure you've heard of this guy named Donald Trump. right? So he started running for the president in 2015, and all the people who didn't like Trump, and I'm, by the way, one of them, accused him of being an authoritarian who would use the powers of the presidency to oppress people. Well, imagine our shock right now. I mean, you maybe have seen these press conferences. I mean, they're accusing Trump of not using enough power to create a national lockdown, and which he's refused to do. He banned flights from Europe. He shouldn't have done that. I think that was a thoroughly evil, wicked thing to do. But beyond that, he's not locked down the entire country. He's mostly left that to mayors and governors, but he's been criticized from which way? From the left, for not being enough of a Stalinist, not being enough of a totalitarian. I mean, to my mind, I'm not sure what's going on in Turkey, but the left wing in this country has been absolutely egregious on all this. The amount of controls that they've been urging, and by the left, I mean everybody from CNN to the New York Times to Salon Magazine to Nation Magazine, to every one of these people has been denouncing Trump for being too laissez-faire, too liberal, and whereas he should have a totalitarian national lockdown. And it's been an absolute shock to me. We should remember that. Again, I don't know what's going on in Turkey, but we should remember this. Now, as for the right wing, okay, that's the left wing. I mean, the left wing has gone full Stalinist in the United States. I'm just telling you, it's just true. It's just absolutely shocking. Now, what is the right wing doing? They're mainly interested in turning this disease into a case for American nationalism. So we're supposed to call it the China virus, block imports from China, shut down global trade, and go all America first and create a trade autarky and all this kind of stuff. So, I mean, the right hasn't been as bad as the left, but they've been also very bad. To me, this is the great tragedy of the times we live in, that a disease has been used and manipulated by political elites for their own purposes. Instead of unleashing medical professionals to mitigate and fix this problem, we turn the disease into an opportunity for every political interest group to take a bite out of our liberties. That's what's been going on here in the United States, and I'm sure it's no different in Turkey too.
Thank you again. Very short question from Frederick. He asks if you would have a different opinion if the disease was as deadly as Ebola, for example, and still the same contagiousness.
My answer to that is no, I would not have a different opinion. I don't think my opinions here are contingent upon the seriousness of the disease. Even if it was as bad as the Imperial College model said it would, I still think human liberty is better. And I'll tell you why. My general outlook, which I probably should have said at the very beginning, is human liberty is always better than any state control. That doesn't mean it's going to create a perfect society. It doesn't fix everything. What it does is it creates an experimental society that's able to adapt, process new information, and respond in the best possible way that is available to the human mind. Only under conditions of liberty can we do that. So even if this were as bad as Ebola or SARS or something else, I would still recommend the same thing. There's no substitute for human liberty as an intelligent system of social organization, recognizing human rights, granting freedom of association, adaptation, discovering new information and responding to it. Only liberty allows that. So that's my view on that. And I should be clear about this because I do think in the early days that the effects of COVID were wildly exaggerated. But that opinion is really different from my view concerning the lockdowns. I would be against the lockdowns even if it were as bad as they said it was going to be.
Nazlıcan from Turkey asks, what would be your predictions for air travel and office-based work in the near future?
Air travel. You said air travel?
Air travel and office-based work.
Okay. Yeah, it's a prediction I got to make, right? That's okay. Here's my view. I think everybody is sick of videos and they're tired of their homes. They're tired of sitting around and they're tired of their local communities. This has been too much for all of us. We're all under isolation. Everybody's despairing. Everybody's sad. We used to think we like to hang out at home and talk on video chat. I think at this point, we've had just about enough of this. So I predict that once we open up, we're going to see international air travel go crazy. People are going to go all over the place. I've had friends tell me as soon as the lockdown ends, they want to go to Punta Cana and hang out at the beaches, which I understand. And they never want to be on another video chat. And going into the office, that sounds great. So I think it's all coming back. I really do. That's just a prediction. It's not ideology or philosophy.
I agree. we all feel that. Will Joseph from Australia, he asks, do you see decentralized databases for medical research, like Apple's Health Kit and Research Kit, as the future? This solution can have medical research done from the iPhones of doctors and patients, and it can be uploaded to a decentralized database. World Health Organization have proven to be unreliable, obviously.
Well, that's a very interesting idea. I mean, blockchain research, blockchain technology could be very valuable here. And I don't know why we don't already have that. So look, I think at the end of this, every government is going to be discredited. I mean, I'm looking forward to a gigantic political upheaval against the CDC, against the World Health Organization. People are going to be furious coming out of this thing. And I mean, in 6 months to a year. So and this isn't just my opinion. Henry Kissinger wrote this in the Wall Street Journal. He said that this virus is not just a threat to human health. It's a threat to every government, because more than anything else, our official institutions have been proven to be absolutely broken. And we need things like decentralized solutions. We need decentralization in everything. The big problem with COVID is we had a central point of failure in every country, and they all massively failed. So we have to take a different route in the future. And that's going to require markets, technology, decentralization, new ways of gathering and sharing information globally. I mean, who knows? I can't say this for sure, but this is creating the conditions for the libertarian revolution that I have always dreamed of, and I think you should too.
So almost everyone agrees that this pandemic will change a lot. But when it comes to us, classical liberals, libertarians, anarcho-capitalists, do you expect anything to change in our strategies? I don't know. Do you think we should change our methods to reach out to people? How can we address this situation?
Yeah, it's going to, and I think it has to, because we've got to get more sophisticated. We've got to get more serious. We've got to get know some more about history and read books, and you can't get libertarianism from memes online or just from surfing Twitter or being a part of a Facebook group. It's not enough. Liberty is a very serious and big, epic philosophy that involves the whole of human life. And that's what's good about this. I mean, this experience is going to make all of you and me and everybody else much more serious about life in general. You know, we look back, 2 months ago, it seemed like life was pretty normal. We were going to bars and theaters and hanging out with our friends and posting on our Instagrams, and we had our career plans and we had our travel plans, and everything was good. And it's all been taken away from us. So we have a new appreciation for, I think, the virtues and beauty of peace and prosperity and liberty. And I hope that you would dedicate yourself to fighting for it, but also dedicate yourself to learning more, becoming more a serious person, reading more books, developing deep convictions and understanding about how liberty works. I have to recommend I mean, so many things I would recommend, but if you haven't read F.A. Hayek, dig deeply into his work, because I think you're going to find something in there that's going to help you guide you to your understanding of the way society works. We need to develop this understanding. So absolutely, I agree. I think this is going to make libertarianism less silly, less superficial, less just a a social group and turn us into a robust and serious intellectual community all over the world. I look forward to working with all of you in the future on this.
Thank you very much. We're also looking forward to. So you think our situation is maybe similar to post-World War II era, like when the ideas of liberty first started in many countries?
Yeah, that's a very interesting analogy, because after World War II, there's a book by Mancur Olson called The Rise and Decline of Nations. And he says that the effect of World War II is to discredit governments all over the world, especially in, of course, Germany and Japan. I've been rereading this book the last several days to understand his thinking. His thinking is that before World War II, we had, both in Germany and Japan, had deeply bureaucratized societies that were filled with interest groups that were feeding off each other. And it just grew and it grew and it grew, and it created a kind of totalitarianism. But after World War II, these structures were completely shattered because it was so disruptive. And that disruption that discredited all the official institutions led to a flourishing of liberty. And so in both Japan and Germany, they experienced much higher growth rates and much higher prosperity than the US and the UK. I mean, it's a little bit ironic, right? They lost the war, but they grew more than the West after the war because it shattered the bureaucracies and discredited all the old elites, and it gave an opportunity for new people to arise in their place. So what if that happens all over the world? I mean, not just in Japan and Germany, but in the US and the UK and Turkey and in Vienna and Spain and Italy. And what if that happens all over the world? I mean, we could actually be preparing the ground for a flourishing of liberty and prosperity like we've never seen before. That's a really interesting idea. I hope to write about that a little bit in the future.
There are a few questions, but we are running out of time, so I will try to summarize 2-3 questions into one. They're about how can we talk to the general public, the scared people, about they should trust the markets instead of governments. What strategies should we use, especially for students groups like us, all around Europe, all around the world? Can you suggest us any practical steps to start fighting against growing power after this pandemic?
Yes, I will say this, that we need to start speaking with confidence, moral courage, not dogmatism, but out of a love for values that everybody shares. The values of peace, of prosperity, human flourishing, a humane treatment of all, an opportunity for everybody to experience the benefits of freedom, universal emancipation. I think these are the kinds of things that we need to talk about, not just because that's rhetorically effective, but because we really believe them. I mean, that's the essence of it. We as libertarians need to stop thinking of ourselves as a tiny, weird cult with a couple of postulates and a handful of friends that rally around a couple of monographs. That's not true. Libertarianism is the fulfillment of the liberal idea itself, which is the thing that gave birth to civilization. We got rid of slavery, we emancipated women, we eliminated despotism and feudalism. We've been defeating hunger and disease and poverty now for 400 years as libertarians. These are the things we need to take credit for and start getting confident about what we believe. And if we don't do it, we will suffer, because the left is incorrect. We don't believe in socialism. The right is incorrect. We don't believe in theocracy and nationalism. We believe in human rights for all, which means peace and prosperity and the best life that you can possibly construct for everyone on earth. That's our themes, and that's what we need to rally around. And this is the time to do it right now, my friends. Thank you.
Thank you. Thank you very much for this insightful session. We are really grateful for your time. We also hope to maybe have you in one of our local conferences in Turkey.
I hope so. Yeah, I'd love to come.
After all of these events. So thank you very much again. I'm sorry for those questions I couldn't ask. Unfortunately, we are out of time. Thank you very much, everyone, for joining us today.
Thanks so much. All the best. Look forward to the future. All right. All right. Bye-bye.
Yeah, thank you, sir.